क्या है, या तो कार्डियक अरेस्ट हो या रेस्पिरेटरी अरेस्ट हो या दोनों चीज हो सकती है। इन कंडीशन में हम लोग सीपीआर करते हैं। ठीक है, तो कार्डियक अरेस्ट बताया। कार्डियक अरेस्ट क्या होता है, इसमें कि हार्ट का फंक्शन रुक जाता है, ब्रीदिंग पैटर्न खत्म हो जाता है और कॉन्शियसनेस लॉस होती है। पेशेंट बेहोश हो गया, हार्ट उसका रुक चुका होगा।
Assume this is road. Okay, this is road. Somebody met with an accident or somebody collapsed, unconscious. So make sure the scene is safe and then kneel down. Step number 1. Step number 2 क्या है? Response check करिए. Sir, are you okay? Sir, wake up. No response at all. Then immediately call for ambulance. Sir, can you please call ambulance, sir? So activate that. Then step number 4. Check the vitals. You have to check the pulse. Carotid pulse. And then you have to clear the airway and check whether the person is breathing or not. I can able to see the abdomen movement. I can able to feel the heart hitting here. So immediately I concluded that the person have a vitals. Ambulance is on the way. Then put them into recovery position. First step is take the hand which is very close to me. Place it like a L shape. Okay. Take the opposite hand. Place it on the opposite shoulder. Sir, you are unconscious. Just silently sleep. No need to do any actions. Just be silent. Step number 3, opposite leg you have to bend like a capital A. Step number 1 क्या है? L shape. Step number 2 क्या है? V shape. Okay. Step number 3, capital A shape. Capital A shape. Now hold the knee, hold the opposite shoulder, pull the person towards you. ये क्या है? This is recovery position, or we can simply say curva position. This is the position which will help the person to puke further. If it is puking or any blood or any saliva, it will automatically drop off, and more blood will flow to brain so that he will recover. If it is normal due to BP, sugar, or temporary unconscious, it will help the person to gain consciousness. So that is why it's called recovery position. So step number 1 क्या है? L shape. Step number 2 क्या है? V shape. Step number 3 क्या है? Capital A. Then hold the both side and then roll the person towards us. Simple. Okay. Identifying the heart location is very important. If I put my hand somewhere and then I keep on doing CPR, it's waste. So identifying the heart location is very important. Everybody, we have that rib cage, right?
Yes.
This rib cage will slowly grow and then it will joint like a V, isn't it? V. From V, कितना inches? 2 inches ऊपर. How do I know 2 inches ऊपर? In your index fingers, half of the size. Your index fingers, half of the size. 2 inch ऊपर. इधर से क्या है? Heart. नीचे क्या है? Heart. And try to locate your V point, everybody please. And move 2 inches above. Locate the heart point and then try to compress this portion. बहुत strong है ना?
Yes.
बहुत strong है. But how do I do 30 compressions and 2 inches deep? So my finger strength is not good enough. So I have to place the heel of the palm. This bone. This bone नाम क्या है? Heel. Okay. So exactly here. इधर देखिए. ये V point. From V point 2 inch ऊपर. That means between the nipples. Either you have to place your heel. Your dominant hand. If you are right-handed, place your right hand first. And then use your another hand. Do interlock like this. Then come 90 degree ऊपर. Because heart is नीचे. So your hand supposed to be ऊपर. And make sure the elbows are straight. Elbows supposed to be straight. I'm doing this CPR compression on the table for demo purpose. Otherwise you have to do the CPR on the floor, hard surface. Kneel down and then do the CPR and use your upper body weight. Your upper body weight you have to push, not from your arms. Arm strength is not good enough. You have to use your upper body and hands supposed to be straight. Okay, and kitna compressions? 30 compressions. Let's see a small demo how they are doing it. So the moment we know there is no pulse, no breathing, immediately locate the V point. From V 2 inches over. Place your feet and interact with your another hand. Then come 90 degree over. Make sure that hands are straight. Elbows are supposed to be straight. Use your upper body weight and go for 2 inches deep. The rib cage will go 2 to 2.5 inches flexible. So use that. compress and release, compress and release. When you compress 1 inch, it will go only to the heart bone level. When you go for 2 inches, then the bone will bend, put the pressure on the heart muscle. Then oxygenated blood will come out. Compress, release, like 100 per minute speed you have to travel. Providing 30 compressions is making 1 cycle of CPR. Okay? Now, you have to push hard. Every single compression you have to push hard. If you are not pushing hard, then it will not reach to heart. Second thing is you have to push fast. That means not 1, 2, 3, 4, 5, not that fast. It is like how much fast you go, how much that pressure will convert the blood to reach the brain region. So push hard and fast. Put hard and fast like this, and then recoil. So hard, fast, and recoil. This is what you have to remember while you are doing the chest compression. Hard, fast, and recoil. When we do the CPR, this is what happening inside the body. We are compressing the heart muscles. From the heart muscles, the oxygenated blood is crushing out. It's reaching all over the body, especially to the brain region. When we release, whatever we send out, that is coming back to heart region. Okay, so this is how you have to compress and release, compress and release. Positive and negative, both are important. Now, after 30 compressions, hard, fast, and recoil, go for next topic, that is airway. Circulation done, then move on to the airway. How to clear the airway? By performing the head tilt, chin lift. After this head tilt, chin lift, immediately outside of the hospital environment, you no need to provide the rescue breath now. After pandemic, COVID pandemic, AHA, American Heart Association announced that no need to provide the mouth-to-mouth resuscitation, just do the hands-only CPR or bystander CPR. That means 30 compressions followed by check for breathing, whether the person has started breathing or not. If no, then go for second cycle of CPR. This is 1 cycle. If no mean, again go for second cycle of CPR. Again go for 30 compressions. Like such, one person can do 5 cycles of CPR. You or me, if anybody started CPR, how many cycles we can do? 5 cycles. That means 30 compressions followed by breathing check. Inside the hospital, we have certain equipments. That is one which ambu mask. Ambu mask, yes. It's a mask and then followed by balloon, right? So you have to use your 5 fingers like a CE method. What is the method name? CE method. These 2 fingers are actually called C. These 3 is actually called E. The C is going to what to do? The C will hold the mask along with the victim face, and then this E is going to open the airway. If you not done the airway open, then the air will not get inside. So you have to clear the airway and use your another hand to squeeze the balloon. How many times? 2 times. 30 compressions followed by 2 breath. Again go for second cycle of CPR. So this is how you have to continue CPR. At one point we have to stop providing CPR. That is when the ambulance arrives. When the ambulance are out of hospital, ambulance arrive, stop performing CPR, hand it over to paramedic, they will take care of it. Number 2, victim started breathing. I compressed 10, 11, 12, and then there must be a gasping sound. Then he got the breath back. He got the pulse back. Immediately check karo within 10 seconds. If everything is okay, stop CPR, put them into Karbat position. Okay, because everything is restarted. You no need to do anything. Just stop CPR, put them into Karbat position. Third point, if you become very tired, because CPR is not easy first aid, that will make you more tired. If you become very tired, means So this is how your compression will be. This compression strength is not good enough. It will not send the oxygenated blood out. It's required like this. This much of energy is required. When you become like this, stop CPR. Call for help. Madam, madam, you provide 30, I'll provide 30. Like that, you have to do 2 rescue CPR until the person starts breathing or ambulance arrives. So this is the point where we have to stop providing CPR. And I would like to explain one more topic, that is types of CPR. There is only 3 types. One is adult, another one is child, and the last one is infant. Adult कौन है? 18 years and above. After puberty, the bone would have been very strong. For them, you have to use your 2 hands and then go for kitna inches?
2 inches.
2 inches. This is for adult. And below 18, from age of 2 to 17, 18 are the body so thin. For them, use your 1 hand. Just 1 hand. Make sure the hand is straight. And then go for 1.5 inches. So this is the child CPR. And third category is infant, newborn baby. That means 0 to 24 months. For them, use your 2 fingers. Kitna fingers? 2 fingers. Like how your hands are straight. Make the fingers are straight. Make the fingers are straight. Not like this. Like this. And then go for 1.5 inches depth or 3/4 of the chest size. So this is the ratio for hand position for infants. So adult 2 hand 2 inches, child 1 hand 1.5 inches, and infant is just 2 fingers 1.5 inches. Clear? So this is the types of CPR.
So I think it's a very good learning session and very good refreshment also.
Correct.
सबसे इम्पोर्टेंट चीज होती है कि चेस्ट के कंप्रेशन का कौन सी डेप्थ में जाना चाहिए तभी हार्ट में कंप्रेस करेगा, अदरवाइज का कोई रिजल्ट नहीं है, वो जीरो है।
अक्सर ये होता है सर कि पशु
नॉर्मली हम सिर्फ कमेंटिंग नहीं करते हैं, खाली हल्का सा प्रेस किया वो चेस्ट आपने हार्ट का पहुंचेगा नहीं, हार्ट को पंप नहीं करेगा तो ब्लड सर्कुलेशन नहीं होगा। तो हमको डीप है ना पंप करना ही है तब इसका रिजल्ट है, अदरवाइज कोई फायदा नहीं।
हेलो मैम, हाय, हेलो, ठीक है। एंड द थर्ड थिंग इज कि हमें इनकी पल्स चेक करना है ना पहले, कैरोटिड वगैरह कि भाई वाइटल्स स्ट्रांग मतलब साउंड्स हैं कि ये ब्रीदिंग वगैरह सारा चेक करना है। अगर नहीं है तो फिर हम सीपीआर के लिए जाएंगे क्योंकि पेशेंट कोई रिस्पांस नहीं कर रहा है ना, तो फिर वही है। अगर मैं राइट हैंडेड हूँ तो मुझे पहले वी शेप की पोजीशन देख के फिर 2 इंचेस ऊपर ये वाला एक पोजीशन इसको मार्क करना है। फिर राइट हैंडेड हूँ तो मैं राइट हैंड को इसको करके लेफ्ट हैंड से इसको सपोर्ट करके, और वो तो स्टार्टिंग फेज है, अभी यहाँ पे स्टार्ट करना है। Okay, and finally 30 कंप्रेशंस के बाद मुझे फिर ठीक है। इसके बाद मुझे इसको एब्डोमेन को भी चेक करते रहना, ये आइज ईयर उसका सिचुएशन चेक करना, एंड देन अगर रिस्पॉन्ड आ रहा है तो ठीक है, अदरवाइज वी हैव टू
Cardiology position. Respond नहीं है, then go for second phase class.
सेकंड